Coming up in the Innovation Sandbox today, we're discussing healthcare interoperability. The interoperability mandates present an amazing opportunity to make much needed and necessary changes to how data is handled across healthcare payers and providers. This is a huge topic, which is why I have two industry geniuses to help me tackle the challenges and light the way for the awesome journey towards innovation, live in 30 seconds. So grab your shovel, prepare to dig in to this week's episode of the Innovation Sandbox. To quote one of our guests, Jordan Hayward, interoperability is an opportunity born out of a challenge. This amazing opportunity is exactly what we wanted to discuss in today's Sandbox. While yes, healthcare organizations must ensure they comply with the CMS Interoperability and Patient Access API mandate, they can and should leverage this opportunity to look at how they can design and implement a data integration and analytics strategy across the enterprise, which goes beyond just complying with the mandate. The healthcare industry has already witnessed its share of disruptions, and this mandate has added to that plate. But the journey to comply with this disruption opens up so many doors, or to quote one of my other guests, disruption will drive the journey. This is such a massive topic that we only have a short amount of time together, so I'd like to jump right into the discussion. Joining me in the Sandbox today are two great minds that have forgotten more about interoperability in healthcare than I ever will. So please give a giant round of applause for Jordan Hayward and Ryan Hodgin. And folks, as always, make sure you type your questions for our panel in the live chat on the right and bottom of your screen, and we'll have plenty of time for Q&A at the end. All right, everybody, take a deep breath and let's start digging. So guys, as an opener, before we dive into this awesome topic, why don't you tell the folks who you are and a little bit about your background? Jordan, let's start with you.
Absolutely. I'd appreciate that. And again, Matt and Prolific's teams, I really am honored to share the stage here with you and to talk about such an important topic. Now, what brings me here today, at IBM over the last 5 years, I've served as the healthcare and life science market leader. And really what that has allowed me to do is have a broad view across both our largest healthcare payers and providers, as well as brand new startups, and go into the depths with them as they're going through the ideation process of how they're going to change and mold healthcare delivery. And so it's an interesting perspective being able to look at both ends of the spectrum and connect the dots between those that are small and agile and able to do things quickly and nimbly, and those others that are more enterprise and have to take a different structured approach to do it. So bringing those two together has actually been quite a great synergy and a great opportunity to share some of those conversations and also connections with clients. So again, thank you. Of course, interoperability has been one of the key topics of the last even 2+ years over many of these clients that I've spoken with.
Awesome. Well, thanks for joining us. Ryan, over to you.
Yeah, hi, I'm Ryan Hodgin. I'm IBM's Global Healthcare and Life Sciences CTO and an IBM Distinguished Engineer. I work with IBM teams and our healthcare clients globally on their technical strategy and transformation work. And so I especially enjoy this topic around interoperability because it's such a key part of the modernization work happening right now within healthcare. So thank you for giving me the chance to join you here, and I look forward to our conversation.
Excellent. Thanks, Ryan. So since we've already given you the mic, let's go ahead and start off with you. So let's talk about the mandate. Can you talk a little bit about the current mandates, but also what do you see potentially in the future? Because this appears to just be the beginning.
Yeah, so in 2021, we've seen a few of the mandates become established. In January, we had the Patient Access API and the Provider Directory mandates from CMS go into effect. And that really requires payers to make data available to members and potentially third-party application developers so that they can use that data to build new applications. In just this month, on April 5th, we had the information blocking provision of the final rule from the 21st Century Cures Act go into effect. And that then impacts payers and HIEs and requiring them to make electronic health information available upon request. So we have some mandates both for payers and providers that have been recently established. On the horizon, there are mandates for more of this type of integration, that we have extensions to the Patient Access API, for for payer to payer integration for members who may be switching payers and moving to different health plans, as well as provider to payer integration for things like prior authorization for claims and clinical data. So we're seeing more of the data types then become integrated and something that will be used then as a part of the future mandates.
Yeah, I'll tell you what, and that's the reason why I was so excited about this topic. And when I did the opening, it really this is definitely an opportunity, and it's organizations need to not just look at the current mandate and how they're going to comply with that, because while there's visibility of what the mandates, what some of the mandates in the future may look like, no one really knows. And our industry is moving so fast, it's going to evolve. So people need to take a more holistic enterprise approach to their overarching strategy. So this is really exciting. So as the global healthcare CTO, you've been around a lot of clients and helping a lot of the clients with their journeys. Do you have some stories that you can share over the last few years?
Sure. So we've really seen clients approach interoperability differently. In some cases, and I think that the pandemic has certainly been a factor in this, we've seen some focus on just doing the bare minimum to meet the mandates. And that'll be things like putting FHIR API endpoints in front of a data lake and just exposing what is required right now under the current set of mandates. And there are some cases where the clients are actually delaying the compliance in lieu of other priorities. And so that's one end of the spectrum. But on the other end, we have some clients who really see what's happening in interoperability as an opportunity to transform, to differentiate themselves from the competition, and potentially to really make some new experiences possible for their patients and their members. When you get down to it, interoperability is more than just sharing data. It is about what you do with that data to impact those patient or member experiences. And that's where we see the most innovation happening. Sometimes it's happening internally as they try to break down silos of data and be able to integrate systems together to be able to do things that they couldn't before. And in some cases, it's working across organizations. We see active participation in the FHIR accelerators like the Karen Alliance and the Da Vinci Project as a way for clients to think through what can be done with other partners to really do some exciting things.
That's amazing. And I tell you what, when I look at stories, I look at a few experiences that I personally had that sort of frustrated me, and it drove me to want to be able to work with our folks inside of Prolifics and also our team at IBM of how we could address that. It's as simple as trying to go in and register for my COVID vaccine, and my healthcare provider, I log into my EHR, go in, and I didn't see any availability, so I went to another one of the networks here. And they use the exact same system, but because it's two different networks, it didn't connect. And there was no connection. I was going to have to reset up an entirely new account over here. And I'm like, why? It doesn't make sense. And then, same thing. I went in and, my daughter, she got sick. And then, we went to one doctor, got x-rays, all sorts of things. And, we ended up having to go to one of the children's hospitals, about a week later. And there was no connection. There was no connection between all of the blood, the blood work and all that. And I'm like, this is, at the time, that was 2020, now we're in 2021, there's no reason for that. And so that's why this is so exciting, so absolutely exciting. So actually that is good for me to lead in for a question for Jordan. So Jordan, I quoted you earlier. Interoperability is an opportunity born out of a challenge. How do you see the mandates helping provide market factors like clinical experience, outcomes, and overall costs?
Absolutely. I'd even focus on just what you called out there is the challenge. I think overall as a culture, as a society, we've all really understood and embraced what this challenge is over the last year going through the pandemic. And interestingly enough, coming into it, for those that are in healthcare, recall last year at HIMSS when they were going to announce all the next provisions that were coming up with it, ironically having to do with data blocking and interoperability. And I think at that time we had no idea just how much we were going to need changes to interoperability and the openness to data. And so what we really have through that challenge is this new opportunity that we can now fast forward and enact change in healthcare that we haven't been able to really enforce for years. Many of us that have been in this for 10, 20 years have noticed this. We're dealing mostly with the same problems we've been dealing with for decades. So by being able to have a structured way to communicate information, it changes all facets of how we really address the quadruple aim. That's how physician burnout is being addressed and how they can spend more quality time with a patient at the point of care. At the heart of the matter really is the patient experience. And so the more that we can get information to really liberate the data about the patient to better inform them so they can make better decisions about their own care, is going to make healthcare more scalable because they can make better decisions on their own. And then with advents coming through things like telehealth, now they can engage in a more remote fashion, and healthcare is much more scalable through it. This isn't the last of what we're going to see with these mandates. This is just the beginning of it. So, one thing that you really have to look at is the challenges that you're seeing today. If you were just thinking of, I'm going to apply to address this CMS mandate as it stands, you're going to be behind it in 6 months or a year when you actually implement those. When those mandates come out, you are going to be behind what the next either startup or the peer or other is going to be doing. So really, you need to take a step back, evaluate the market, the landscape, and think, what is it that is my ultimate goal? And I'll guarantee you, with the startup space, with great partners like Prolifics, there are resources out there that can help you scale faster to meet those objectives and aims, which you previously thought is, shot at the moon and big audacious goals. And now they're realistic. Those types of things can happen today through the simple capabilities that FHIR interoperability bring us. But it's a much bigger problem than just connecting APIs and connecting data. So we'll get to that in a moment. But definitely a great question in leading into this new opportunity that we have ahead.
Excellent, excellent. Yeah, and you know what? It was interesting. You mentioned telehealth. It's so after diving into this space, like we have, I follow a lot of different sites, and I get in my email every day I probably get 10 or 20 different healthcare related emails, and telehealth has become such an amazing topic. And it seems like when you start talking about government, it seems like there's going to be a lot of funding that's going to be coming down from from the federal government to states to providers to be able to enhance the amount of their telehealth capabilities. I mean, is that what you're seeing?
Absolutely. I mean, we've got from one end the CARES Act that brings new funneling of money into creating solutions to impact the overall delivery of healthcare. But on the private side, we have just as much money coming in. For those that are kind of watching the VC world, this last quarter was the best ever. We had roughly 150 different deals of ventures that were launched out, $6.5 above billion were invested in. So the private entity as well as government, they're coming together in a full force to really enact change that we're seeing here. And this is the perfect time to be doing that. I look at this is the perfect storm to be really where we all these things we wanted to do for decades. Now we actually have the right timing of it. We have the mandates that are in place that are going to enable it. And the technology is there that we can actually take advantage of all these things and pull them together. So it's no better time really to be in healthcare IT and to be able to drive these change. And of course, the benefactor of all that is you and I. It's the consumer, it's the patient. We're going to see the benefit of all this coming forward. Really exciting.
Outstanding. Well, okay. So on the topic of the mandate, normally we wait to the end to do the Q&A, but I can't wait. There's some really good questions that are coming in. So one question that came in is, and Ryan, I'll kick this over to you. So FHIR has been around for a number of years. Why do you think it's taken organizations so long to adopt?
Well, I think it's a long process of adoption. That what we're working with is working from a legacy of healthcare data in different formats and different structures. And what it's taken is different healthcare organizations looking at FHIR from their own perspective, giving in to a broader community, and then aligning that with a common standard. And I think we're still a ways to go. We're seeing still the use of extensions where we'd like to see more common elements in FHIR defined, but it's a difficult problem to solve. This is something that spans not just the US either. This is being adopted internationally. And so that perspective is something that needs to be taken into account as well.
Excellent. Okay. So another one just came in. So I'm going to go back up. So Jordan,
Let me add actually onto that. That was an interesting point, and something that just kind of came to mind is thinking about it. I think the reality really that we dealt with is for the longest time, the viewpoint data is power. And until we really looked at, and of course, when data is power, we're thinking that's where we want to harness and hold in that information and not allow that to be freely, given to the masses to be able to improve something or be able to make things more efficient. I think as we changed our mindset overall as a society that we've got to really democratize information and make it more freely accessible, that it's that tide that is rising up that is improving things overall. It is improving business for all those entities that traditionally hosted all the information. Now the segue of information collecting and transporting back and through is improving their business while also improving the lives of those that we're actually collecting information on. So it's a pivotal moment in time.
Yeah, I'll tell you what. I mean, that's a theme that you'll see across a lot of our innovation sandboxes. To where when you look at us as a business, when we talk to our customers, data is at the heart of everything. And so it's amazing to now be able to see these mandates that are really tapping a lot of these organizations on the shoulder and saying, listen, there's a lot of untapped gold inside of your data. Start using it to provide better service to your patients and your customers. So, Jordan, while you're still talking, another question came in. So you and I were talking a little bit about telehealth. So a question just came in. Does telehealth make it more difficult to manage patient data?
Yes, I think so. But there's the caveat to that. So it's a yes and a no. So on one side, that patient data now starts coming in more freely in interactions in visual. So let's say, for instance, they're doing a telehealth visit, and traditionally where you're just having a conversation and you're trying to tell the tone, the inflections of that patient and understand what they're really going through. Now, under traditional settings, you would just be taking notes. But as a doctor's interacting with them, they actually may notice certain behavioral changes in their tone that may have, as many would see where I'm going with this, things like stroke. So using things like natural language processing tied into those data streams completely change that. And then as you start pulling in machine learning to actually extrapolate that data out, tag it so that we can start looking at inferences of information, now it grows. So yes, it's complex. It adds more capability to it. But overall, as we ease the ability to get access to that information, of course, with approval by patients, then it makes the long tail it's much easier because the information flowing now is disseminated and just the pertinent information that's relevant to the patient is what they're going through, pulling all their medical history into context can be placed right in front of the physician so they don't have to spend 10, 15 minutes poring over the record. They've got it right there. So it's much better decisions at the point of care. But lastly on this, on the other challenge that I think we don't often think about is the security ramifications of this. With access to information freely flowing, to take a very concerted and planned effort into what provisions are you going to put into so ensure that the data that you're sending is who you're expecting to send it to and that they are qualified and that they have the right provisions to be able to have and protect that information. So lots to definitely plan for, but there are great solutions to handle it today.
Okay. I got a few more questions that are flowing in, but I've got a couple of other questions that I had set. And so the next couple of questions are for both of you. And Ryan, I think I'll start with you in this first one. So what would you tell an organization that is only focused on complying with the CMS mandates?
Yeah, so I encourage them to really think through what the value could be of going beyond the mandates. Just looking at different organizations and how they're considering interoperability, there's such a different set of perspectives on it. But what it comes down to for those that are really innovating around it is it's looking at trying to break down barriers that exist today that keep them from accomplishing some of the objectives that they have. And that could be improving the member experience. It could be addressing the cost. Are different elements that can be addressed with interoperability that are worth really thinking through and has potential to improve the value to the patients and the members that they serve, as well as the organization itself. So think through that, make that a part of the strategy, see how then you can work internally to accomplish that, as well as then with external partners.
Excellent. Jordan, what do you think?
So I would actually take a perspective on it that planning for solely what is required of you actually puts your organization at risk. So there's looking at, again, talking about all the innovative things that are coming about in the market, startups that are going on there. The mandate we know is going to change. And if we plan for just implementing the bare minimum, it really is a point in time where we could either thrive by acting now, or, and I know this isn't the analogy that's really appropriate, but we may not survive as a organization to see what tomorrow brings. And so that's a big change. It's a mindset that we need to take on, that we've got to be proactive in thinking about how we plan for, how to utilize this data, how to protect it, and how to make the most out of the access that we have out there. And really what we're looking at, this is born out, this is the age of transparency that we are looking at and openness. And this is driving everything really to how we're architecting, how we're sharing information, and how we're communicating in and amongst ourselves and with physicians. And so it's a great time really to enact on that. But we've certainly have to make that choice now, and it has to be a very thoughtful plan going forward.
It sounds like good parenting advice, just in general. It's like sort of like you tell your kids.
I kind of felt like my dad with that comment.
Yeah. You can do, okay, so you can do the bare minimum, but that's not going to set you up for, for the future. So you probably want to think bigger. So, absolutely. And it also goes down to disrupt or be disrupted.
At 100%.
So, okay. So my last question, and I'm going to dive into a couple of the questions we've got from the audience. So whether you're a healthcare payer or a provider, so each of these organizations have these gigantic systems they're being told that you don't need anything else. I mean, everything you need to do for whether you're a payer or provider, you can do it in this system. Whether it's, for example, your EHR, or if you're a payer, some of the large claim systems that's out there, you only need this, and we'll just do all these bolt-ons, and you're good. How should organizations implement a more which would encompass these systems along with everything else in the enterprise? Ryan, what do you think?
Yeah, so I think a common theme that we see with interoperability is adaptability, is flexibility. It's being able to really rapidly respond to different things and be able to integrate and innovate through different combinations of the system. So it isn't simply driven through that one gigantic system. And it's very likely that gigantic system you're referring to isn't running in public cloud today. It's likely running on-premise in a data center, which means that the data that is so important for interoperability is running there too. And so what we have seen more clients do is try to then augment that system with additional tools and capabilities there where the data exists to try to get more value out of it there, rather than try to move everything up into the public cloud and have the cost and the complexity of shipping everything back and forth. So taking a hybrid cloud approach lets you then put things where it can do the most good. And that could be data and AI tools to get more insight from the data that's there. It could be more of the application code. And then looking at the mandates that are ahead, it could be things like the integration with EMR, with more of the smart apps and smart fire-based applications. And so there's just, you want flexibility in the strategy to be able to then best meet the mandates and then go beyond that.
Excellent. Jordan, what do you think?
I look at this, and we're all in tech, right? So we understand the challenge here, or really the opportunity we're at. We want to try to say, hey, it's a best of breed approach, and we want everyone to use the same system, and that's how we'll standardize. But let's get real. The reality is everyone is using disparate systems across the board. Any one healthcare system is using multiple EMRs. They have different facets of information coming in and flowing to them freely. So we have to embrace a hybrid cloud approach to be able to address these problems. So let's look at actually just the data component of it. If we rely just solely on our traditional clinical or EMR information, that could be in just a couple different iterations or versions of some of the major EMR players. But that really represents 10 to 20% of the whole life of that patient. Once you start looking at behavioral, you start looking at genomics, you start looking at labs, all the other things and social determinants of health, all these other collectives and aggregates of data that influence how you're going to treat that patient, how you're going to interact with them, the true background of what they're doing on a daily, not just the checkpoints they come in when they're sick. All those different variances make it a difference. And so being able to architect for that, knowing that some of that information is going to be born on the cloud, and that's right for it, right? Consumer-based information in applications, wearables like my watch, all that data we can collect directly off the cloud. But our legacy apps, they may not be ripe or ready for the cloud, and so there's components like monolith microservice where you actually take components of the application and you start to extrapolate out the interface and put the interface where PHI isn't directly being stored into a cloud and keeping the data where it's protected behind your own data centers and where you have control over that information, or where there may be government regulations around that as well. So there are tactics, there are strategies to it, but openly, I think we all could admit we have to embrace a hybrid cloud approach to be able to address these problems. There's no one size fits all. Every organization we completely recognize is different. And so we have to step back. We have to really take a look at what's the problem at hand and what's the existing landscape that we're looking at. There's not always reason to rip and replace. There's oftentimes a good reason to take a look at and let's just modernize components of an application and transition that forward. So it's really the ultimate way to look forward, saving costs on it without completely burdening the IT with trying to reinvent the wheel.
So let's continue to pull that thread. There's a great question that just came in, and I'm going to start off. And Ryan, is from a CTO's perspective. This is a relevant question that we've heard because you look at it to where there's a lot of these large organizations that have a lot of infrastructure. They've got a lot of people. They've got capital to be able to do a lot of this. For smaller providers, how do you plan for the future with the limited resources and to be compliant now?
Yeah, so I think the nice thing is that you don't have to do it alone, that there are communities that are established that you can work with and be a part of to help do that. And I mentioned the FIRE accelerators, like the Karen Alliance and the Vinci Project. There are others as well, that there's a broader community that is addressing these same problems that you can work with. What I would add on to that, though, is that this is also an international problem. It's not just US. And so the community isn't limited to just United States participants. It's much broader than that. And it's worth being a part of it and following what's happening.
Excellent. Okay. So, all right. I mean, there's so many questions that have come in here. I think we're going to have to do another episode of the Innovation Sandbox with you guys to dive in a little bit deeper because there's been some really, really good questions. But unfortunately, that is all the time we have for today. Guys, thank you so much for taking the time to come by, play alongside me here in the Innovation Sandbox. Also, as a thank you, we've got an awesome gift for both of you guys. And so, popping it up on the screen, it is so exciting that you guys, took the time out of your day to share this wealth of information with me and also with everyone that's joined us today. So thank you so much. And to our audience, thanks for stopping by. Keep looking forward and keep innovating.